Hello, everyone. Welcome to our informational webinar for weight loss surgery in Mexico. We moved our monthly webinar to this week because of it was coinciding with July 4th. So I like to welcome everyone. I'm still waiting for more people to join, and we will get started soon. Let me see. Just one moment. Since we are waiting for everyone to join, I just wanted to go over the raffle that we do every time. This is a great opportunity for one lucky winner to get $2,000 off of the surgery package, which is our package already affordable, but this even makes it more appealing to get that $2,000 off. So just make sure if you have not filled out a health questionnaire on our website, on MBC website, just go ahead and do that. If you have, it's okay. We just switch you to Dr. Rodriguez. If you are submitting a new HQ, please select Dr. Christian Rodriguez as a surgeon of your choice. And one of the rules of participating in the raffle is to watch the webinar to the end and be present. And we do the raffle at the very end after our Q&A session. Okay, just give me a moment again. I'm trying to get Dr. Rodriguez online with us, but so basically, so we can get started. Again, my name is Ron Ellie, and I'm the founder and CEO of Mexico Bariatric Center, MBC. And today we have Dr. Christian Rodriguez as a surgeon that's gonna help us explain about the different procedures we offer and get the medical questions answered. Again, if you have not filled out the health questionnaire, please go ahead and do that. Go into our MexicoBariatricCenter.com website, fill out the health questionnaire, ask Dr. Christian Rodriguez as a surgeon of your choice. We'll try to cover the questions, answers that are commonly asked during the presentation. So please pay attention so that would explain or answer any questions you have. And then at the end, whatever that we have not covered, of course, we try to answer it as much as we have time and do the best we can. If you don't get your answer, you can still reach back out to us just a moment. Okay, so let's see. I need to. Okay, I'm still trying to get Dr. Rodriguez to be. So who raised hand? Okay. Okay, so I think we having finally, let's see. Hello, hi, Dr. Rodriguez. How are you?
Hello, everyone. How are you?
Good. So, we lost your picture. Yeah, now you're muted. So you want to tell us where you are joining with us with the webinar?
Hello, everyone. How are you? Today, we're going to talk about the weight loss surgery, and feel free to ask everything. I'm going to answer all your questions. So I'm very nice to be with you.
Well, I know you were away from T1.
Oh, yes, I am in Mazatlan. We are in the national bariatric meeting. I'm part of the. Today, I'm a professor. I did some duodenal speech classes for all the Mexican bariatric surgeons. So I'm very glad to be here.
Well, thank you, because I know you guys have a heavy and hectic schedule, and I know a bunch of our surgeons are there. Have you met?
Yes, Dr. Valenzuela is here and Dr. Gutierrez is here. So yeah.
Yeah, and actually we don't have much surgeries because all of our surgeons are gone. Okay, well, again, thank you. Well, let's continue with our presentation. So the topics we're going to cover today is pretty much what is obesity, risks of obesity, and weight loss surgery, what weight loss surgery can do for you, and what MBC, Mexico Bariatric Center, can do for you. And Dr. Rodriguez is going to take over and talk about all the procedures we offer, laparoscopic, endoscopic, all the options, revisional, etc. And we would talk about importance of bariatric vitamins, which is Emerge, is our own brand, Emerge Bariatric Vitamins. And then we open it up for Q&A session. And after we are done, as much as time allows, we're going to answer questions, and we'll get to the raffle at the end. Basically, obesity is a metabolic disease, is a multifactorial disease. And part of the, our genetics plays a huge role. Of course, our lifestyle and modern age conveniences, the sugary drink or ultra processed food, all that is contributing to this problem and makes it even worse. In a medical community, they have a way to determine whether you're obese or not, and that's just basically a formula that you plug in your height and weight, and they give you a number, and that number pretty much is a determination of where you are in this chart. And if our BMI is below 25, we consider normal. And between 25 and 30 is called overweight. And after that is in obesity. And then they have a degree of what degree of obesity there is. So morbidly obese, super morbidly obese, super morbidly obese. And one thing I need to mention here is our center, there is no limit of what BMI we can operate on. As long as you can get yourself down there, you'll be able to operate on you. Of course, it's a great idea to do a good pre-op diet. We were just talking to a patient yesterday that he's 920 pounds, and we were trying to find out how to get him down there. But Dr. Rodriguez has already operated on one, which is the highest BMI we had, which is 110. Okay, like I talked about, what are the factors contributing to obesity, the increased nutrient content of a food, the lack of activity, comfort eating, stress eating, that's huge, inadequate sleep, and the drugs that we may take. When we gain weight, our fat cells not only increase in size, increase in numbers too, and it would have a structural change. As you see on the picture on my right on my screen, there is a difference between adipose tissue or fat cells of an obese versus a lean person. And that is why it's causing all the problems like insensitivity to insulin, leptin, to therapies, to vaccination, and like even, there's so many side effects of this. One is your muscles don't respond, or they become resistant to protein and exercise. So the fat in our body prevents our muscles to grow and get stronger. So, all these different side effects. And, we talked about risk factors. Okay, 40% of Americans are considered obese, adult Americans. So it's impacting US as well as the rest of the world. But because we have a high population, it puts us in a high ranking among other countries in the world. I always like to play this animation about what happens, for example, to our lungs when we accumulate fat in the abdomen. So let's watch that together. It's very simple.
Consider this. Our diaphragm is one of the major muscles that helps with breathing. Breathe in and the diaphragm contracts and the lungs expand to take in oxygen. But if you're obese, fat in the abdomen can push on the diaphragm, limiting how much air you take in.
And of course, all the side effects and comorbidities that comes with obesity. Heart problems, cardiovascular problems, diabetes type 2. We talked about how the lungs are getting affected, and all the other things. Chronic inflammation, not responding to insulin and leptin. And during COVID-19, we learned that this being overweight and being obese and the extra fat in our body is not a good thing, because the people who had it got affected more. They got more susceptible to catch the coronavirus and end up in the ICU and death as a result of that. And I don't know where you guys live, what's happening. Well, we see more and more of the COVID, and this time around, it looks like people getting COVID, and it's pretty severe. And so it's not gone away. So that's just one reason to live a healthy life and do something about our weight, extra weight. So what is the cure for obesity? Okay, so diet and exercise is great. We need to eat healthy, eat clean food, and have a clean, diet. But exercise, be active. Even regular walks, whatever you can fit in your schedule. But it's not a proven long-term solution for obesity, as we will see why. And then from the time that human history, we tried to find that magic pill to take or inject and lose weight. And it is kind of happening with semaglutide medications like Ozempic. And again, we're going to go over that real quick to see what's the deal with these medications. And the only solid solution, proven solution, long-term, safe, and quick way of losing weight is still bariatric surgeries. This is a good way of explaining why diet and exercise is hard to do and reach to your goal weight. And basically, once you start going on diet, your body starts to resist by decreasing your metabolism, increasing your hunger, and decreasing your satiety. And here's the explanation. Basically, metabolic system is the one responsible for our body to resist against diet. And the difference between diet and exercise and bariatric surgery is bariatric surgery resets your metabolic system. And let's say if a person weighs 250 and they do extreme diet and exercise, like a boot camp type of exercise, and they lose 75 pounds, your body is going to resist again, like we saw in the picture before this. Your hunger goes up, your metabolism goes down, it's going to resist that. It wants to take you back to 250 because that's where your body is set to operate. Your brain and your hormones are interacting in that 250-pound thermostat. And then bariatric surgery, because it changes your hormones, the minute you wake up, your brain sees you at a different weight, and you're in the what we call overfed mode, and that's why your hunger goes down and your metabolism goes up. So that is the difference between diet, exercise, even the medication with bariatric surgery. Okay, so we talked about medications, right? Ozempic is the new slew of medications that is like Mounjaro, Wegovy, and Ozempic. Ozempic is really just for diabetes type 2, but then people use it to lose weight as well. But there are more and more medications coming, which, as you see on my right side, these are when you go through bariatric surgery, all these hormones are affected, from ghrelin to CCK to GLP-1, GIP, PYY, amylin, incretin hormones, fat hormones, leptin, adipose. And so basically the breakthrough of these medication is they're trying to simulate the effect of these hormones. And you know, it's just been recent that they tried to find out why bariatric surgery is so effective. And then they started digging more and more, and then now they're finding all the hormones that changed by the surgery. And this is a natural occurring changes in the hormone because of the rerouting your intestine or changing your stomach, changing the size of your stomach. These are occurring naturally, but with these Ozempic type of medications, you're actually injecting hormones in your body, and you would stop losing weight if you don't use the medication. So you have to keep using it indefinitely. And of course, you know, first of all, there's going to be a question of what is going to happen to your body long term when you put these hormones indefinitely, and of course the cost. And another thing that bariatric surgery gives you is the restriction, which is a mechanical physical restriction. So not only it makes your stomach smaller, that you cannot eat as much as before. So you have the caloric intake limitation. It also plays a role in all the hormones that you see listed. There is more actually. They're finding more and more of these hormones that are part of the bariatric surgery. And then now the pharmaceutical industry trying to simulate what bariatric surgery does, but still is lacking the physical and mechanical component of it. And again, what is the long-term effect of putting these medications in your body? I bet you your kidney is going to be affected. Your gallbladder is going to be affected. There is muscle mass loss. So a patient that loses weight, they lose 60% more muscle mass than a regular weight loss. So that's actually a concern. And then all the other components that can actually get affected. And this is a chart to show like what is the diet and exercise effectiveness for population. And you see where bariatric surgery, which is the surgical intervention for obesity, it stands. You know, we also offer endoscopic procedure, which Dr. Rodriguez is going to talk about. So the cost of this life-changing bariatric procedure is very high in the US. And there is no surprise because there is a lot involved. The instrumentation is expensive. The hospital, you know, staying in the hospital and all that stuff is expensive. And even like in other countries like Canada, the procedure is free, but then you have to wait so long to get it. So the solution is what we call medical tourism, going across the border to get these life-changing procedures. Now, the question is, okay, I want to go to, let's say, Mexico, which is one of the top destinations for weight loss surgery. And how do I go about it? Well, you need to do your research. First of all, you need to go with a facilitator that knows what they're doing. So they pick you up. You don't have to worry. The minute you land in San Diego, you don't have to worry about where do I go next? Is my hotel reservation done? Am I going to get picked up on time? So all this is arranged for you. And look for their reviews, real reviews, not just a TikTok video, because it's easy to put up a video and make it look, you know, cute and fancy, but not really have content behind it. Look at how many years they've been in business. What's their like? What's their reviews like? MBC is in the forefront of bariatric surgery worldwide. We are one of the top medical tourism companies, and there is a reason behind it. The surgeons, we will talk about surgeons shortly. The years in medical tourism we have, myself, I got involved in this business in 2007. And the reviews we talked about, the medical care, post-op care, pre-op care, and the treatment you get down there. Okay, so one of the factors that is really sometimes overlooked is the surgeon itself, right? So medical tourism is so many parts into it. There is coordination, then there is surgeon, and then there is the hospital facilities, before care, after care. So all these components you have to consider and plays a role. So what we see is during the 2021 and 2022, there was so many bariatric patients that went down to Mexico. A lot of the surgeons or a lot of the doctors start looking to become a bariatric surgeon. They got trained, they became assistant surgeon or not, and now they want to become a lead surgeon. But the problem is, and you see so many of them, there is a difference between a surgeon with 20, 50, 200 surgeries and a surgeon with 5, 6, 7,000. And I usually like to compare this to a pilot. And a pilot with, let's say, 1,000 hours of flight time cannot handle turbulence and the difficult situations like a pilot with a 50,000 hours of flight experience. And this happened actually, I just happened to see it a couple of weeks ago. There was a pilot that the main pilot let the assistant take over, and the flight came 450 feet of ground that almost had an accident. So this is the difference. You want, yes, most of the time, nothing bad happens. But it is that one time that is going to cost your life. Because that inexperienced or assistant surgeon is running into a situation in your surgery that cannot handle because they don't have the experience. So you see, because the prices are pretty much very affordable and economically feasible, but there are these assistant surgeons that are advertising at a lower price, and they're making it very attractive. They put a TikTok, they put this, but what is behind them? So by definition, a specialized, experienced surgeon need to have at least 5 years of high volume, dedicated practice in that field, plus in-depth knowledge and education of using the techniques and be up to date, like our doctors are going to these different congresses and shows and different events to update their knowledge. That's what it takes. So right here, why not choose MBC? All of our surgeons have over few thousand, 5, 6, 7,000 surgeries behind them. Dr. Valenzuela, for example, she's been with us alone for 12 years now. 12 years. 12 years of being a dedicated surgeon doing the same type of surgery. Actually, our surgeons are, I see that over and over because I go to Tijuana often, that our surgeon actually going to helping other surgeons to rescue their surgeries. Believe me, they do it in bariatrics, they do it in plastics. So what you see sometimes is just a name. That surgeon doesn't actually do your surgery. They bring other assistant surgeons, inexperienced surgeons, interns, and they're the one doing the surgery. And that's why it's a few $100 cheaper. So there you go. This is why you choose MBC. The support you get before, after, lifelong care and support. We are a US corporation in California, BBB A+ rated. We manage our surgeons' load, daily load. Our processes are 1, 2, 3. You can get approved, go on the calendar, pay online, get on the book. And 12 years, MBC has 12 years with over 22,000 surgeries behind it, successful surgeries. We also offer MTI, of course, is optional, but that gives you a peace of mind that, okay, if my travel is interrupted or I get any problem with surgery, it's covered. So why would you look somewhere else when you have MBC that is offering all type of procedures? I also talk about that. So another reasons not to go to these other companies is, okay, so let's say somebody needs a bypass and the BMI is, let's say, is 55. Do you know not a lot of surgeons can actually in Mexico can do bypass, not alone do bypass over 45 BMI? So what's going to do, they do two things. One is they can approve for bypass, take you down there and say, hey, bypass is not good for you, we give you a sleeve. And then, or right off the bat, they said, no, you don't need to have bypass, you get sleep. But for certain people, you really need to get that type of surgeries. Like, for example, DS, we always say, oh, duodenal switch surgeries are very, very invasive, right? But look at the data. 15-year data shows that the DS has a better result than bypass in a 15-year super obese patients. So if they cannot offer you DS or all these complicated surgeries, what are they going to do? They're going to give you what they only can offer. And one thing about plastic surgery is, like, if they mess up with plastic surgery, let's say your stomach is going to look uneven, right? But the bariatrics is even more important because it's your internal. You'll be suffering, not be doing well, and not being healthy for the rest of your life if you get the wrong procedure. It will not show, you will not see it, but you will suffer. I see that often. They tell the patient, oh, you don't need this. Because that's all they can do. They can do sleeve all day. Even the sleeve, we will talk about how a sleeve can be different from surgeon to surgeon. It's not like, okay, every sleeve is the same. Oh yeah, they put the same size of boogie down your mouth and to your stomach, and they cut it around it. How close you cut to the boogie and how well you shape that stomach is a big deal. Do they look for hernia, or they're in a hurry and they don't just like, okay, sleeve in and out? if you need hernia repair, because if you have a hernia and not repaired, you're gonna have a problem with you know, reflux. So there are all these factors that you have to consider. So when they advertise on Google, oh, it's like $3,900 or whatever, it's about your well-being and it's about your life. So, but it has come down to price. Always gastric sleeve in Mexico is $4,000. Our price is $43.95 starting for a gastric sleeve. But that you get, see what you get for that price. It's a deal of the century, what we offer. The type of surgeons you get, the type of facilities you get, the type of support you get. You cannot compare different packages by price. See where you're going. Do your research, see where you're going. And in our efforts to always, we've been the leading in this industry, and we've been leading all the other companies, and they always imitate us. So this project, Hospital Azar, is another attempt for us to step up the care that you get with medical tourism at affordable prices. We have this project that we started back in 2021. I've always wanted to do this for years, but finally got it in the paper, on the paper with the architects, designed this with medical tourists in mind. This is not just a hospital that takes walk-in emergency and this and that. This is one of the best projects ever done in medical tourism because it's made around medical tourists. And you will see so we have 4 ORs, about 40 rooms, and in-house X-ray, in-house lab. The technology that we have put in this place is, I heard, we are like number 2 or 3 in Tijuana as far as the technology. There's so much is in factors in every package that you get, from the pre-op test for your blood, to the sterilization, to the nurses, how closely they follow the COFEPRIS, which is the Health Department, Federal Department of Mexico, how close they work with them, how closely so if you are COFEPRIS licensed for real and approved, you can get international accreditation because their standard is as good as any standard around the world, and maybe even more strict. Anyway, this is the project that I've been working on. We cannot wait to go online. Of course, you know, there's so many components beside just the facility itself that we need to, implement to get started, but we are very close. This is one of the early stages that Dr. Franzuela and I and Flora, we were in the hospital. This is framing stage. This is years ago. And our packages are all-inclusive. We talked about that. You know, we keep you in the hotel one night before. You can stay after surgery if you like. Your companion stays with you the first night in the hotel. You go to the hospital, you get surgery, you stay there 2 or 3 nights. Again, you can stay more if you want to come back to hotel, or you can go back home. Our approval procedure processes are very simple. Is 1, 2, 3. You do the HQ. You put a deposit. You can even do that. Once you get your approval, you can actually book yourself online. And then you complete your paperwork, talk about long life, support. This is one of the support ways we support you. We have few groups that the main one has over 10,000 of our past patients. Of course, is a private group, just our past patients. And then there are so many ways we support you. One way is our past patients that are helping us. Sarita, Rena, Dawn, Kelly, Jamie, these are our past patients that are playing as a support and coordination, just part of our team. For example, this is Rena's success story. She's one of our top coordinators. She does the podcast with Sarita. I recommend you watch that. So if people who joined later, if you have not filled out a health questionnaire, please go ahead and do so. If you have, you don't need to submit another one. You go to mexicobariatriccenter.com/health-questionnaire. You fill out the health questionnaire and select Dr. Rodriguez. And you need to watch the webinar to the end to be able to participate in our wrap. This is the team of surgeons we are exclusively working with. Dr. Miguel Montalvo, Luciana Valenzuela, we mentioned, Alejandro Gutierrez, Rodriguez Lopez, Jacqueline Usuna, Dr. Jesus Ceja, talking about experience. Dr. Usuna started with me back in 2010. That's about 14 years just with me. And she had prior experience when I met her back in Guadalajara. She lives in Guadalajara and she travels to Tijuana. Another way that you differentiates us from other companies are your health questionnaire goes through our surgeon liaison, and every HQ gets reviewed and quality controlled by our surgeon liaison. And we have this logic in our software that would matches you with the best surgeon if you don't have preference. So let's say based on your BMI, type of surgery, your age, all that, it will match you with the best surgeon for you. And then, of course, our surgeon liaison sitting and watching every HQ going back and forth between you and the surgeon. Our pre-op diet is very simple, straightforward. If your BMI is low, close to 30, you just need a 2-day clear liquid. And after that, your duration, your pre-op diet goes higher. Now, here's the thing. A lot of people have problem with pre-op diet. And pre-op diet, in a way, is a way to see if you're committed to this procedure, because you really need to be committed. This is just a tool that you acquire that can help you with your weight loss journey. And it's very important that you committed from get-go. Your pre-op diet is very important because, of course, like part of it is not smoking. It makes the surgery easier for you and the surgeon. It won't matter what your BMI is. Let's say your BMI is 58 and you do a good job on pre-op diet. You'll be better off in the surgery and after to recover, and the surgeon has an easier time because your liver shrinks. You have given the surgeon more room to work in your abdominal cavity. And that's what you get by doing a good job on pre-op diet. So, and I see some people, they just like, this is, do the best you can in the pre-op diet. That's all I can say. Do the best you can. It's not exact science, but all you have to do is cut down sugar and carbs and take protein shakes and take protein, like eat more like salad with chicken, fish. And here's the thing, another benefits going with us. We have an in-house nutritionist that is very experienced, very knowledgeable. We will have webinars for you for pre-op, post-op. You can always call, text, email, or get on the webinar to learn what are the ways to get pre-op the proper way, and post-op. Post-op is very important too. At this time, we're using several hotels. One of them is in Hyatt, highly in demand in Tijuana. And make sure you stop blood thinners no matter what, because you will be instructed of what medication to stop and what medication not to take or take after your procedure. For people who are taking Ozempic, please stop at least 2 to 3 weeks prior to the surgery. Again, we talked about smoking and Advil, things like that, stop. And take the bottle of your medication with you to Tijuana. Just the bottle, so we know like what is it that you take on a regular basis. When you arrive, we want you to arrive before noon, so we have enough time to do your pre-op test, your EKG, your blood test. And when you're done, we take you to the hotel. You stay there for the night, relax. And once we tell you what time to show up, we take you to the hospital and you get your procedure. Your companion, again, stays with you the first night. They can come and visit you, but they stay behind in the hotel and they can enjoy like really good breakfast in Hyatt. That's where I stay when I go, and they have a pretty good breakfast. And surgery day, you be getting ready to get the procedure, and you stay there based on your procedure 2 or 3 nights in the hospital. You do all the testing, leak test, and you're ready to go. If you want to again stay longer, you can by just telling your coordinator to arrange for you. Otherwise, fly home, fly safe travel. You need to make sure you don't sit there long, whether you're driving or you're flying. Make sure you get up and walk around, put compression socks on. And again, one of the reasons we're so successful with the highest success rate and lowest complication rate is our surgeon's load management. So we manage the load of the surgeon on a daily basis. Based on the complexity of the procedure, we limit how many they do every day. And our complication is less than 1%, which is actually 0.5%. And that is amazing. And complications are usually like, maybe simple bleeding that we can repair, or like wound infection, things like that, if you don't take care of your incisions. I would let Dr. Rodriguez take over here and talk about, well, let me give you a little introduction about Dr. Christian Rodriguez Lopez is one of our top surgeons. He's our super surgeon. And, he studied medicine in University of Tijuana, and he finished in 2010. He's been doing bariatric surgeries since 2014. So here we go, 10 years of experience. He is actually a very skilled surgeon with a wide range of surgical skills. And that's why he can perform all these difficult surgeries like duodenal switches, revisional, reversals, you name it, single incision, gastric sleeve. He has over 5,500 surgeries. And remember, we talked about how many years with how high volume you need to have to become that specialized, you know, experienced surgeon. Just not to get distracted here, but I want to tell you, there's a surgeon that just started a company. They have a website. They all look like NBC. And I was reading the explanation about the surgeon. They said that he is he is the second surgeon working with Mexico Bariatric Center. Well, I didn't know his name, so I digged around and I found out that he used to be assistant to Dr. V, and he just started his own business. So when they say on the website, I'm the second surgeon with NBC, you would think that he's the second rank or is like right below the chief surgeon. But what he meant is like, I was assistant surgeon to one of your surgeons. So, okay, their price is, I don't know, $4,100, but there you go. That's what you get. Shopping for price. So this is explanation about who Dr. Rodriguez is, and we have a privilege to have him. He really made exception with his busy schedule in that Congress to join us. So Dr. Rodriguez, if you're ready, I'm going to let you take over and talk about all the procedures. Thank you so much.
Yes, I'm ready. Thank you so much for the introduction, Rod. So there are a lot of options in weight loss procedures, okay? We have surgeries, and also we have endoscopic treatments. Endoscopic, we don't do incisions, but there are considered like surgeries because we need to do stitches. I'm talking about the endoscopic sleeve gastroplasty, DSG, or when patients already have a bypass, we can do a revisional, endoscopic revisional, and we can make the anastomosis smaller. But all of this is with endoscopic procedure. No incisions, but we need to do suturing. So it is like a surgery, okay? So we have many options of weight loss surgeries. And every patient needs a different treatment because everybody's different. Weight loss surgery is a tool. So every patient needs a different tool, okay? So we can go from a small tool to a big tool, okay? Gastric banding. The gastric banding probably is the first weight loss surgery in the world. Right now, lap banding, we don't do any more lap banding because we have a better option. Right now, we are taking out a lot of banding to convert to a gastric sleeve. The gastric sleeve is the most important weight loss surgery right now in the world. The mini gastric sleeve, in traditional gastric sleeve, we can do, we need to do 4 or 5 incisions to get inside of the stomach, but sometimes we can do a mini gastric sleeve when we can do less incisions and we can take out a less percentage of the stomach out. Traditionally, gastric sleeve, we need to take 70 to 80% of the stomach out. In mini gastric sleeve, we can take from 50 or 60% of the stomach. Single incision gastric sleeve. In the single incision gastric sleeve, we do everything through the belly bottom. It's gonna be a incision through the belly, so it's gonna be like a scarsless surgery. This is everything for aesthetic results. So you need to be BMI lower than 40 to be able to do single incision gastric sleeve. The airway gastric bypass is gold standard of surgery. This is when patients are around 40 BMI. We have the mini gastric bypass surgery. When we do, it's like it's not less invasive. So, but sometimes we can do one anastomosis because error-wise, two anastomosis, two reconnections of the small bowel. So mini gastric sleeve is another option. The duodenal switch is a bigger tool. This is designated to patients with BMI higher than 50. And also we have the one anastomosis duodenal switch. It is the same procedure, but only with one reconnection. Also, we can do a revisional surgery when you already have a previous weight loss surgery and you regain or you did not get the weight goal that you want. We can do a revisional. We can go to from gastric bypass to NY gastric bypass. We can go from gastric bypass to duodenal switch, or we can do redo all the parts of all gastric bypass. Okay, so that is the revisional surgery. When we go to the so this is the gastric sleeve. In the gastric sleeve, we need to we make a smaller stomach. The stomach is the first part of the digestive system. So what we want to do is a smaller stomach, so you'll be able to feel full with less food. So we can remove from 70 to 85% of the stomach. We can do it with 1 or 5 incisions. And the part of the stomach that we remove produce the ghrelin hormone. And this is very important because this is the hungry hormone. If we remove that part of the stomach, it's gonna be much easier to do your diet. So it's gonna be an extra help in the weight loss. Also, we can do the gastric sleeve from 1 incision that is gonna be through the belly button. And this is only for aesthetic. To be able to do this procedure, your BMI must be lower than 40, okay? So this is really, really nice if you want an aesthetic result. The endoscopic gastric sleeve, or ESG, the correct name is endoscopic gastroplasty. But what we want to do is to shrink the stomach from the inside. We need to do incisions. We need to do, suturing. We need to put some stitches from inside of your stomach. We do this everything endoscopic, no incisions in the skin. We try to make it like a laparoscopic gastric sleeve. It's not gonna be the same. If your goal, if your BMI is around 28 or 32 of BMI, probably is gonna be the best option for you because the weight loss results are not the same if we compare to the surgery. But if your goal is around 20 or 30 pounds, probably is gonna be this can be a good option for you. The airway gastric bypass. In this surgery, what we do is to make the stomach smaller, like a gastric sleeve, but also we need to reconnect the small bowel. We can reconnect. If we do this, you will have a part of the small bowel that is not working. It's gonna be there, but it's not working. So this is gonna help you to lose more weight. This is a bigger tool. And if your BMI is around 40 or higher, this probably is gonna be the best option. Also, if you have acid reflux, this is gonna be the best surgery for you because we can control the acid reflux with this procedure. So, what you will need. So, if your BMI is around 30 to 40, probably the best option is gonna be the gastric sleeve, okay? If your BMI is around 40, 45, 48, 30, 38. And if you have a slower metabolism, and if you like sweet food, probably the best option is going to be the gastric bypass. Okay, it is a bigger tool, but sometimes you don't need a big tool because your goal, the weight goal is not too much. The gastric sleeve is going to be a good option. If you are a really disciplined patient and your BMI is not too high, the gastric sleeve is going to be enough. Okay. The mini gastric bypass is the one anastomosis gastric bypass. In traditional bypass, an airway gastric bypass, we need to reconnect two parts of the small bowel. In this surgery, we only reconnect one part of the small bowel. Okay. The results are almost the same if we compare to the gastric airway gastric bypass. Probably, if you don't have acid reflux, this could be a good option for you. But sometimes your goal is not too much, so we can do this procedure. It is a novel procedure, so it is a good option also for weight loss surgery. So if you have acid reflux or other comorbidities like an ulcer, probably the best option is going to be the airway gastric bypass. Okay, the weight goal is almost the same. So sometimes when patients are hard to do surgery, we can do a shorter procedure, and the mini gastric bypass is going to be a good option when they have hard comorbidities, long comorbidities, and we need to do a faster procedure. So the mini gastric bypass is going to be a better option. But both are great procedures. Both are gastric bypass. Okay. The duodenal switch. The duodenal switch, we have two options: the traditional, that is the BPD, and the one anastomosis duodenal switch. This is the best bariatric surgery. This is the best metabolic surgery, and it is destined for patients that the BMI is too high. Probably when the BMI is higher than 50, or if you have a previous surgery, this could be a good option for a revisional surgery. Okay, so something important you need to know about this procedure, that the discipline is really important. You need to take for supplementation, protein and vitamins. If you're gonna do this procedure, you must know that you will need supplementations for life. Okay, because if you don't do supplementation in this surgery, you can have malnutrition. We can go to the other part of that we don't want, but if you don't do supplementation with protein, probably you can have malnutrition. Okay, and we don't want that. PCOS. The bariatric surgery is a metabolic surgery. Okay, this will control all your bad cycles of hormones. PCOS, it is a discontrol of the hormones of the ovary, and if we do surgery with PCOS, you're going to be able to control all their hormones, and you will be able to have pregnancy, and you will have all the benefits of the metabolic surgery. So if your problem is PCOS, the weight loss surgery, the metabolic surgery is going to be the best treatment for you. We have many patients that we did the weight loss surgery, and they have kids after the weight loss surgery. So that is really, really amazing with the metabolic surgery. So how fast can I return to work after bariatric surgery? This is a minimal invasive procedures. So after 1 week, you're gonna be able to go back to if you do office jobs, you're gonna be able to go back to a desk or office jobs. If you wanna walk, or if you do low lifting works, probably 2 weeks is gonna be the time. If you have, if you work with around 20 pounds or 30 pounds, probably 3 weeks is gonna be the time you will need to take out for recovery. And after 4 weeks, you're gonna be okay to do everything you want. You're gonna be able to do exercise. You're gonna be able to do lifting in the gym. So 4 weeks is the time your incision needs to heal. So after 4 weeks, you're gonna be able to go back to everything. Okay, about the COVID restrictions or recommendation, what we want to recommend is to bring or wear a mask. That is an option. To have the social distancing. If you want, you can do a test before you travel. And vaccination is a recommendation that we do, but it's also an option if you want to be safety in COVID recommendation.
Well, thank you so much taking time to explain all the procedures. I'm just gonna go over a little bit more of travel-related issues like financing. Our packages are very affordable, but you can look into getting financing. We work with a couple of companies, and then there are other options like SoFi, LendingTree, and all that. Or your bank could be a good option. Credit unions are great options. Because banks already have a relationship, so they may be able to give you personal loans. And just remember not to apply for too many places at one time, because every time they pull your credit and it's going to hurt your scores. Talked about medical tourism insurance coverage. We offer a $400 plus coverage for $149. And that covers all these complications, travel-related interruptions, and so on and so forth for a maximum of $25,000. And this is a great way to get peace of mind. I recommend everyone to get that. At the beginning, when you're signing up, they send you a link. You can pay online and get registered. Sign up for this option. And it covers up to 45 days after surgery. So that's when you come back and something happens, you still can use it. Dr. Rodriguez mentioned about supplementation. So we have Emerge Bariatric Vitamins, comes in 4 different forms of soft chew, chewable, drinkable capsules. So you can try to see which one works for you best. And basically, these vitamins are for bariatric patients, which your body needs after bariatric surgery. It's not a multivitamin that everyone can buy from Walmart. This is something that you need specifically with the ingredient, the amount of each ingredient that your body needs based on ASMBS recommendations. We've been doing this MBC care package, so we are sending you a package when you arrive home. Make sure when you get the link, you subscribe to it and take advantage of this. You pay for shipping and it gets sent to you for free. So we are at the stage that we're gonna open up to question and answers, and let's see how far we can do. So Lorinda is asking, no, I don't need anybody to be on the webcam. As long as we know you're present in the webinar, that's pretty much how you qualify to be entered in the draft. Hello, everyone. Again, some people say hello, but I didn't see that before. There are some rules of how far out you can schedule if you win the raffle. So this raffle is just for Dr. Rodriguez for the procedures that he offers. So again, if you win the raffle, we can switch you to Dr. Rodriguez if you want. So Dr. Rodriguez left, I think. So I'm going to try to answer the questions as best I can. So endoscopic sleeve, which is we call ESG, right? So the ESG pretty much follows the same pre-op post-op, and it's because it's not a surgical procedure. That means they're not removing your ghrelin hormones, or they're just giving you restriction. It's very important to be mindful of your diet. But the post-op is not the same because, you know, you still can do the same. Do go 4 weeks of liquid to solid post-op. But again, you know, it is not the same, but you need to be mindful that the diet and exercise is very important to lose weight with ESG. Okay, as far as revision of a bypass to a DS or SADI, Dr. Rodriguez is a specialist worldwide in doing SADI, but we can sign you up for a revision of a bypass to SADI, but it may not be feasible. Again, a lot of situations happen in the OR that determines what can or cannot be done. When we so you can sign up, but we cannot guarantee the reversal or revisional like that. Yes, your guest stays with you in the hotel when you stay in the hotel, in the same room. Okay, so the way it works is you fly a day before your operation. Of course, you can come earlier if you like. If you're flying long distance or you're driving long distance, you have option to stay there in Tijuana or in San Diego. If your flight comes in a very like the times that is off hours, you can stay in Hampton Inn in San Diego by the airport, in which we have like a special going on for our patients. You can mention that to Hampton Inn and they get a special rate. But but normally you come the day before surgery. Your surgery, let's say if it's a sleeve, you stay 2 nights and then you're ready to leave. Again, you have option to extend that going back to hotel. But if it's a DS or bypass, you come the day before surgery, you stay 3 nights, and then you leave. So for gastric sleeve, it's 3 nights total. For bypass and DS, it's 4 nights total. For balloon, we keep you 1 night in the hospital, so it'll be 2 nights. Okay, and we did talk about how long you can go back to work. Basically, going back to work is like that. If you're not doing any lifting or heavy activities at work, you're fine to go back, maybe even in a week. It depends on how you feel. You may be feeling a little exhausted, but nothing out of ordinary. Just don't stress. You keep up with the post-op diet, like I said, from liquid to solid, and you know, just be mindful of how much activities you do or what heavy lifting you do or whatever. And so the pain basically so as far as the lifting, if you are doing heavy lifting like exercising stuff, wait 6 to 8 weeks at least out. You can walk, you can do little, you know, activities, but not heavy lifting like going to the gym and lifting 200 pounds. Wait for 6 to 8 weeks at least. Sure. Thank you, Chris. Jennifer, let me see what question. I'm just going by let me see. Well, so single incision gastric sleeve is the same exact as regular gastric sleeve. The only difference is instead of making, sometimes if you do a good job on pre-op diet, our surgeons can get away with 3 incisions only. But if you want just 1 incision through the belly button, which is not going to show up after you recover, your BMI needs to be less than 40, and also there is no difference as far as the sleeve itself is concerned. So when you leave the hospital, they give you the antibiotics. They give you a little liquid like a Melox. It's not Melox, but it's like, you know, that covers your stomach. And you can buy over the counter antacid. That's it. And some pain medication too. Well, that's what you get when you leave. Okay, so what is the best option for a revision of a bypass? We have what Dr. Rodriguez talked about. You could do TOR, which is endoscopically tightening your pouch. And that's one option. But you may need more than that. You may need limb extension, which means they take the bypass point to a lower point to be more distal, or you could go to SADI or duodenal switch. But remember that the conversion of a bypass to SADI is not guaranteed. Based on your health questionnaire, they can approve you. Doesn't mean that can be done. So this is a risk you're taking. But they do whatever they can do to make your revisional surgery of a bypass more effective for you. Again, when you go into revisional surgeries, especially when you have bypass, your bypass revision may not be as effective as the first time, and the risk of complication goes higher. So just remember. So this is something we need to be remembering. Okay. All right, so let me make sure Anna is asking for that one slide. Okay. I make sure that. Do you need medical files? Okay, so that's actually good. Lorinda is asking, do we need to bring any medical files or vaccinations? Okay, so we don't need to see vaccinations, but what I recommend is to do just a regular blood test before you come. Because especially the patients who have revisional surgeries, your hemoglobin level could be lower. People who have had bypass usually have a lower hemoglobin level. And that's why you want your, make sure your hemoglobin level is not too low. So when you come there, you don't need to have blood transfusion. That really helps. So for FSA, HSA, you can try. Sometimes it goes through. If the FSA, the FSA HSA usually goes through. You can try it on our website online to see you can pay by that. Usually it goes through. No, we cannot sell you Emerge Bariatric to take home yet. We are working on that though. With the new hospital, we may be able to do it, but right now it's all just shipping. And I wanted to mention about the care package, the MBC care package. That is for US patients only. Okay, so the surgery, let's say we're talking about $43.95 starting for gastric sleeve. That is not including BMI. If your BMI is over 49, 59, 69, 79, these are all kicking in additional charges like $395 and up $595. And if it's a revision surgery, it needs more revisional $595 because the surgeon sometimes they do endoscopy, make sure your previous surgery is intact, especially for band to sleeve or band to bypass. And then there is a scar tissues from previous surgery that they have to clean before they get to your stomach. So that's why there's higher price for revisional. If you need your gallbladder, for example, it's extra fee. All these are extra fees. And that's something I need to mention. I'm glad you guys brought it up because sometimes they advertise the lower prices on sleeve, but when I look at the additional charges, they are extremely higher, or they get you on, oh, you need to pay for nutrition consult. So you have to be careful. This is a lot of it is like marketing what they're doing, but you have to, at the end of the day, they're going to charge you one way or the other. So yes, we could do husband and wife for the same day. Rena is asking, and we are not actually booked too far out. Could be some days that we don't have opening, but for sure we could put you in one day to both of you get surgery. Yes, we do FMLA, work-related paperwork. That's what we do. Again, you get support before surgery, you get support after surgery. You can always call us back and say, hey, I need this. We'll be here. In my experience, the best option for a sleeve revision is a mini bypass. And that does it. you get to your goal weight. I've seen it over and over. So we charge $159 for our hotel, which is a good deal. I'm honest with you. Sometimes, you guys, if I don't have reservation in Hyatt, they charge me over $200 a night for me to stay there. And we are providing 159 at a contract rate, which we've been with Hyatt over 10 years. And that's the best rate that they're giving us. And we are transferring that rate to you. So 159 a night is for hotel. It's not just like, there are hotels there, but Hyatt is the best one in Tijuana at this time. So Dr. Rodriguez mentioned about weight regain. Sleeve is a great surgery, but remember, you don't have the malabsorption component, right? With the bypass, DS, the mini bypass, SADI, all these, you get the malabsorption component because they bypass part of your intestine. But with the sleeve, you only get, well, it's not only, you get the restriction, which is we talked about when we were talking about bariatric versus Ozempic. You get the restriction, which is physical, and there are all the different hormonal changes, and that is causing the weight loss. But after 2 years, your hormonal changes start getting imbalanced. Your stomach can stretch a little. You get a little insensitive to the restriction. So then what you eat is important. How active you are is important. We have patients like Sarita. Sarita, I don't know, is like 7, 8 years into her surgery. She still is in great shape, right? Because she takes care of herself and she eats well, she exercises, so there is no problem. With the sleeve, you can get by. But bypass, mini bypass, DS is different story. Okay, so if the surgeon finds hernia during the surgery, there is a $395 for revision of a hernia repair. And it needs to be done, otherwise you need to go to get another surgery to fix it. We are not too busy right now. Well, this month is different because a lot of our surgeons are in this national congress in Mexico. But we have some availability toward the end of July and August. We have availability, so no worries there. So anybody who has had HQ in our system and is watching this webinar to the end is going to be entered in the raffle. Okay. So that's actually, yeah. So the travel interruption of the MTI is if it's medical related, right? That's what Danielle told me. Yeah, I mean, anytime you need to contact our surgeons, you can reach us and we will get you in contact with them. So this is how it works. You get approved and so once you get approved, they send you a link that you can go online and you can actually find a spot for that surgeon that is open and matches your opening. and then you pay the deposit, and that's it. You can pay as low as $200 to reserve your spot. And then you start doing your paperwork, get your flight or driving arrangement, and you're good to go. You do your pre-op, of course. So okay, so skin removal after losing weight. We work with top plastic board certified surgeons in Mexico. Not only they're board certified, they are specialists in post-bariatric patients. Post-bariatric patients is not the same surgery as a regular because your skin is different, your hemoglobin is different. Everything in the post-bariatric patient is different. And if the surgeon doesn't have the specialty to deal with that, you're not going to be able to get good results. MexicoCosmeticCenter.com, you can go there, apply to get consultation for plastics. Now, do you get loose skin? Depends on your genetics, on your age, on how fast you lose weight, how you take care of your skin when you lose weight, and of course, your before surgery BMI, right? But not everyone needs excess skin surgery after losing weight. But if you do, you go to MexicoCosmeticCenter.com and you submit that. So if you're taking any medication on a regular basis, bring the bottle with you. Okay, so usually the gastric sleeve from what they call from skin to skin is about 1.5 hours. So you walk into the surgical area, they do the anesthesiologist start talking to you, they put the medication in you, and then the surgery itself is about 30 minutes to 45 minutes, and that's it. The same thing, actually, they asked about ESG too. ESG has a little longer period in the procedure because all the suturing and stitching takes time. So again, the best option for these are all like the same. Okay, so okay, perfect. That's another question about passport. We highly recommend that you bring a passport book or passport card. That makes the thing so much easier to cross. Sometimes you can get away with just birth certificate or driver's license, but most of the time it's better to have passport because there are a bunch of people in the van going across. And if one of you gets stuck, everyone is going to lose their flight. And nowadays, you can get your passport fast, and even on a regular basis, it comes faster. It's not like COVID time. And to be honest with you, border is something like EU when I cross, sometimes it's a longer wait. We use medical passes, and sometimes like Sundays are busy regardless. And but like you get to a lane that all of a sudden goes slow, and the officer can have that day, and they just they can pull you to secondary. As far as the pain level, so everyone's pain tolerance is different, right? And if you're taking pain medication on a regular basis, then you need to up it when you are doing the surgery. But if you don't, the pain level can be very simple by little pain medication to go away. So the pain level is not high at all. As long as you start walking right after the procedure, as soon as you can, start walking, because the gas is the one that gives you the pain. If you release the gases that is in your stomach, then you fine. You don't have any pain. So that's the one thing. About long term, we're talking about 30% of patients need a revisional surgery due to weight regain and some other symptoms, right? Let's say if you get gastric sleeve and you have still reflux problems, you need to convert to a bypass. So these are all including weight regain is less than 30% of post-bariatric patient needs revision. But we don't see that in our practice. We see more like 10%, less than 10%. But that the 30% is what is published. We see 10%. Yeah, you can bring the bottle empty, or best is just bring the bottle with a bunch of medications in them. You be instructed what medication to stop and what medication to start, when and how. So everyone will be instructed based on their 4 weeks, you can start eating solids. So one thing I want to mention, please be respectful and mindful of your surgery date. We do a lot of managing each patient's file. We are connected through different complicated software with here to Mexico. You go into a different country. So please make sure, first of all, your payment is taken care of 2 weeks prior to the surgery. Please stick to the pre-op diet and try not to reschedule or cancel, because we send these, we talked about Hyatt, for example. We send the Hyatt reservation a month in advance. That's how we get opening. And then we have the driver ready, the hospital ready, the surgeon ready. So all this is set to go. And remember how many pieces are into this puzzle. So please be respectful. Try not to skip on your pre-op diet or do things to jeopardize to be able to reschedule or cancel. Yes, so you can, so the last day after your stay in hospital, we take you back to the airport. I still have 66 unanswered. So if the surgeon asks for any extra documentation or cardio clearance, lab test, the coordinator would reach out to you and say, hey, I need this information to get your approval. So no worries there. Yes, so the cost of the hotel is already in the package. If you want to stay extra, then you pay the $159 per night. Or for your companion, we have to charge you. You know, there's so many things I want to talk about, but one of the things that makes us different is you see the owner's face. I am putting myself out. I am there with patients. I go to the same hotel they stay. I go to the same places they stay. I check everything out. I just got back Friday. I'm going back again Tuesday. I'm always around. You may not see me. You may see me in Hyatt, say hi to me. But other companies, who is the owner? Who is behind all these names that they put out? Who's really running the show? So that's the first question you ask. Who's the company I'm going with? Do I know? Do I know who the guy is, you know, good or bad? I'm putting myself in front of people. You see me. I'm not some hidden name, some secret owner that who knows who it is, how they work. You know, we've been working long term, and you see our results, you see our name, you see who we are. We're not like some mystery website or a social media channel on Instagram. Again, Image Bariatrics is only online. So the only one I have about maybe a few more minutes to answer these questions was Jennifer Harville. Can you please tell me what your question was? Can you tell me your question, please, so I can answer it? Again, I have a lot of the duplicates and questions are here. I'm trying to look to see which one. So we do have intermediate ICU, and yes, of course, we have with other hospitals that can handle major emergencies. Okay. I think I answered all this. Yeah, the blood test before you come, it just be something that shows your hemoglobin, you know, just a normal blood test, nothing complicated. We recommend you do the COVID test. I see more and more COVID. I don't know where you guys are, but I see more and more COVID. And it's good to test yourself, your companion before you come, so you know not to expose other people. You know, it's just a courtesy. And then the same thing when you get down there. Let me see if I can find Jennifer's question. Okay, so Jennifer, he hasn't posted anything. So what I recommend is we can go to the raffle. So people have been waiting. And any question is not answered, circle back with your coordinator. You can go through your coordinator to ask the same question and you get answer, or you could call our office and ask questions that it wasn't answered. I'm sorry, you know, there are so many other questions that aren't answered. Okay, so so the raffle. Okay, so we have all the names in this book that are basically have done an HQ and they qualify to be in the raffle. All the names are here. Okay, so last time I had a webinar with Dr. V. Valenzuela, and one of the patients reached back to her on Facebook and say, hey, I don't think this is real because I didn't see the person. We're gonna let the person talk. I hope they're still there and we open it up so they can talk, and it's not a fake or any thing we're doing the wrong way. Okay, so here's the let me read it to you. Quinte Asia. I hope I didn't say the first name the wrong way. Okay, so this is the owner. This is the winner. Quinte. Okay, so let me go and see if I can find you. No, I'll let you talk. There you go. Hello. You can unmute yourself. Quinte Asia. I see you. I'm trying to say unmute yourself, please, so you can talk to us. Can you talk to us? Oh, there you go. Hello.
Hi,
Hi, so what's your first name? I'm sorry if I messed it up.
go by Queenie.
Weenie, okay, how are you?
I'm fine.
Okay, well, congratulations. You want to tell more about yourself, where you live, planning to come have surgery?
Oh, yes, I live in Texas. I'm 30 years old.
Okay,
Uh,
which part?
Hold on. Mm,
Okay, so
Ah.
which part of Texas do you live?
I live in Houston.
Houston, okay. So,
Mm.
all right, well, congratulations.
Oh, thank you.
Your coordinator is going to contact you to sign you up. And you want to tell me more about, like what is your weight loss journey has been? And
Wow, thank you. Thank you for the opportunity. Yes, I right now I weigh 230 pounds. So
and how tall are you?
hello?
Yes, sir, we hear you. Go ahead.
Sorry, I was distracted. I have I weigh 244 pounds right now, but I've been trying to lose weight and I lose and I gain weight.
Mhm.
So I decided to I had a friend that did this gastric sleeve with you, and she told me about it, and I decided to take the route.
Awesome. So good to hear. I mean, we would love to have you down there. And, this is a great opportunity, not only taking advantage of the $2,000 off, but, change your life and you're very young, this is a time to do it. I'm very glad for you.
Thank you so much, sir. Thank you again.
Oh, thank you for attending, everyone. I hope we see you again. If not in the webinar, we see you down there in Mexico. And you take care and look forward to seeing you again. Goodbye. And thank you, Dr. Rodriguez, for spending time with us. But we have to go.